atopic dermatitis is one of the most frequent diseases in dermatology around the world, and it was also defined as neurodermatitis in the last centuries before it became aware that also the immune system plays a significant role in the pathophysiology of atopic dermatitis. However, what is often forgotten is that pruritus is the hallmark of atopic dermatitis, and we also have to understand the pruritus in these patients in order to treat them efficiently and understand the disease better. Pruritus is mediated by sensory nerves which start in the skin and end up in the brain. And we know from many studies in the recent years that chronic pruritus can be addictive and also can amplify itself, and therefore plays also a significant role in the development and in the maintenance of the disease. So the brain is connected to the skin nerves, and we have revealed also with other scientists that, for example, there are centers in the brain changed in patients with atopic dermatitis. For example, the brain areas which are responsible for addiction, responsible for reward, and that may explain why patients have this sometimes compulsive scratching behavior and also this chronic behavior without having any trigger. And studies in recent years have revealed, especially based on imaging and molecular biology, that there are specific brain centers which are alterated in patients with atopic dermatitis and chronic diseases, and also in the spinal cord. And that may change the behavior also of patients with atopic dermatitis. So that has also a clinical relevance, because that means that we can also probably treat patients with atopic dermatitis by blocking pathways which are going from the skin into the brain. And therefore understanding that will also lead to novel therapies. There we have to differentiate in atopic dermatitis about what stage we are also talking about. Definitely it's a chronic inflammatory skin disease, and in the acute phase there is a release of cytokines, and we and others also revealed the molecular mechanism of these cytokine receptors on sensory nerve endings. For example, we described the interleukin-31 receptor on sensory nerve ending, and shown that cytokines like IL-31, IL-4, IL-13 directly activate the receptors on the sensory nerve ending, leading to cell signaling, JAK-STAT pathway signaling in these sensory nerves, and then leading to pruritus. So that's in the acute phase. However, in the chronic phase, like in prurigo or in lichenified form of atopic dermatitis, there is also the changes in the spinal cord and in the brain, which then lead to the chronification of pruritus. It's similar to pain, where in acute pain I can treat with certain medication, but if I have a patient who has pain for 1 year, I need other medications to block with opioids, for example, or gabapentin, because there are changes in the plasticity of the spinal cord and the brain. And this is similar in pruritus or in prurigo, where I have, on the one hand, a peripheral itch, and I have a central itch. And I need to know when I have to treat. And sometimes, probably in some patients, I need to use a biologic, like blocking IL-4, IL-13 pathway, IL-31 pathway, but that may take a while. And also in these chronified patients with prurigo and with lichenified atopic dermatitis, I may also need another medication in addition, which then help to break this vicious cycle of itching and scratching, so that also the patients have a better prognosis which prevents them from relapses. So successful for the treatment of itch by stopping the scratching behavior. So I think there's several interesting developments now with respect to through the understanding of the brain-skin connection. One of them is the GABA agonists, which are involved in the reward and in addiction, and they may also be interesting for the treatment of pruritus in the future. Then we are awaiting also new results from the NK1 receptor antagonists, because we know that substance P plays a role in the central nervous system in the brain-skin connection, and may also be beneficial for the patients with atopic dermatitis, but probably in addition to the anti-inflammatory therapies.